Dr. Kaye, who's conducting this study on carpal tunnel syndrome, which is such a big problem, because people using computers all the time, it's in their wrists. They really do suffer. It's serious, isn't it?
Yeah, it really is. And I think Tim mentioned a little bit earlier in your first segment, but the repetitive use of hands or any other joint many times can cause inflammation in the median nerve. It's the main nerve that supplies half your hand.
Right.
And so with this repetitive use, you have an inflammation in a small tunnel. It's like tunnel, that's what's carpal tunnel, of bone where the nerve has to go through. So as that nerve swells up from the inflammation, puts pressure on the nerve, causes the nerve to dysfunction in a sense. So you experience pain in your wrist, you experience numbness, you experience weakness, and so it's a major problem both from a financial and a human suffering point of view.
How's the test going?
Well, the reason for doing the testing is we want to do a formalized FDA guided study so that we could prove conclusively that this device is really effective. And in order to do that, you really have to do it on a double-blind, it's called double-blind crossover method, which means that you divide up your subjects, your patients, into half group gets the real device, that's an actual device. The other is a sham device, even though it has a little bit of a signal, so they can't tell the difference. I don't know the difference. And so we do that for 30 days. We give them a break. And at the end of 30 days, the people that had the real device now have the sham device, and vice versa. So this way, by doing consecutive measurements on nerve function, on images within the tunnel, and a whole group of medically accepted tests, we can prove conclusively to FDA's satisfaction that this is truly effective, because anybody can say this works, and a lot of people have had great success, but when you come down to that kind of a study, you're really proving your point.
Very interesting. For more information on this technology, visit the website Avazia, spelled AVAZZIA.com.